Welcome back to video 3 of our series on supraspinatus tendinopathy. In this video, we're going to be talking about prognosis and progressions as you work through your rehab plan. So when we start out, our initial prognosis for somebody with this type of injury is 8 to 12 weeks. The reason being that tissue healing takes at least 8 weeks to go through the phases of healing. And with the shoulder in particular, a lot of times it's hard to have a straight line with your rehab because there are going to be periods of flaring up and improvement, so it's never quite a straight line. So during the initial phases of the physiotherapy treatment plan, we're going to be starting with some isometric exercises just to try to create some tissue load tolerance and also to desensitize that tendon in the tissue. So with those exercises, it'll help you kind of reduce your pain while we also work on regaining your range of motion. The next phase that we work into, phase 2, we'll be starting to regain strength through range. So that's going to involve working with bands and or weights to try to make your tendon strong through its entire range of motion. We're also going to be looking to address any changes in your posture or your shoulder blade mechanics at that time. And then during the last phase, we're going to look at returning you to some of your functional activities that you might be limited in. So if there's certain sports you want to get back to, or if your profession requires you to do repetitive upper body loading, we're going to adapt our exercises to kind of match those demands. With the prognosis of 8 to 12 weeks, as you get older, your ability of your tendons to heal starts to decrease because your body's not as efficient at reproducing the cells required to heal the tissue. So that timeline might be a little bit longer if you're of an older age. And the other factor to consider is what are your work demands and daily life demands? If you have more activities throughout your day that are causing the shoulder to get irritated, that timeline is going to be a little bit slower than somebody who's able to give it a bit more proper rest. When you get through the rest of your treatment plan and we get towards the end, we're really looking at building the endurance and load tolerance to be able to allow you to get back to all those activities that you weren't able to do because of the pain.